see here. Amazing. Okay. Hi, everyone. Welcome to our October office hours. We have nurse practitioner here, Jessica Chrisman. My name is Alex Ruiz. I am the Director of Content Community here at Paloma Health. And in case you didn't know before we get started, Paloma Health is a full online medical practice, meaning that our providers, like Jessica Chrisman here, can see you and treat you for your thyroid health. We specialize in hypothyroidism and Hashimoto's, and we do so through not only medication interventions, but also lifestyle and nutritional strategies, which we know are super important for your overall care and thyroid health. Many benefits using Paloma Health. We have an online mobile app, which is amazing. We have a lot of resources on there. You could track your symptoms, which is one of our biggest benefits of the app. We also have tons of resources like yoga, strength training. We have tons of gluten-free recipes and more for you to try. And then alongside that, we are online medical practice. So all of our care is done virtually. So that means no commutes, no long waits, no racking up mileage on your car. You can see all of your providers from the comfort of your own home. So without further ado, thank you so much for attending today's office hours. I'm going to go ahead and pass the baton here to Jessica Chrisman, and we'll get started with today's event.
Hi, everyone. My name is Jessica Chrisman. I've been a nurse practitioner for about 10 years now. And for the last 5 years, I've really been focusing on the functional medicine side. Working in regular primary care, I noticed a lot of the times, patients still had symptoms, even though they looked good on paper. So working in the functional medicine side, especially for people with hypothyroid, for me has been really rewarding to help people feel better. So that's a little bit about me, and I'm excited to be here today and answer your questions. So the first question is, I've had high TPO since 2021. The rest of my thyroid levels are within normal range. It's recommended that I take supplements and exercise as well as diet. Is there a way to get my TPO down? That's a really good question. So when you have TPO levels that are elevated, we know that that means that your body is currently in a little bit of what I like to call attack mode. So it's confusing the thyroid gland for invader tissue. So what we want to do is kind of calm down the immune system and help the body stop attacking the thyroid. So one of the ways to do that definitely is with diet. So going gluten-free, which I know can be hard at sometimes, is really important. The molecules in gluten can mimic the molecules of the thyroid gland. So when you're eating gluten, that can cause more of an immune response, and it can cause your body to attack the thyroid even more. So one really important thing is to be gluten-free. After you try gluten-free for 3 to 6 months, you should start to feel a little better. At that point, if you're willing, trying to reduce your dairy as well, because dairy also has a little bit of that molecular mimicry component. So that's diet. Also important for diet is to make sure you're getting enough protein. So trying to get about 60 grams of protein per day, getting nice amount of vegetables per meal, and keeping carbohydrates around like 150 grams per day. In terms of exercise, you definitely want to move the body. Ways to move the body that will reduce stress, such as yoga, are really helpful, but also just getting at least 30 minutes of cardio about 4 times a week. So that's for exercise. In terms of supplements, making sure that your vitamin D level is within range. If your vitamin D is low, that can increase the antibodies. Making sure that your selenium and iodine are balanced. Most multivitamins will have a little bit of selenium and iodine in them, so normally just taking a multivitamin can cover you for that. There are cases where taking supplements like systemic enzymes to capsules at nighttime have also been shown to reduce the antibody levels. So there are a lot of different ways you can go about it. Working with your doctor, I would recommend just kind of going step by step and going through the process. Okay, the next question is, at one point in my journey, I was taking 1 grain of NDT twice daily plus 12 of T3 twice daily. It helped bring down my reverse T3. Now that my reverse T3 is normalized, I'm having trouble getting dialed back in. When we add a small dose of T3 to see how I respond. Is T3 no longer necessary? Have you seen this in patients before? So it's a little bit hard to answer that question without knowing what your current T3 levels are. There are cases that when you take NDT and your immune system starts to stabilize, that means your body isn't going to be attacking your thyroid as much. So once your thyroid is able to produce more hormones, there's a chance that you might no longer need the T3. But again, without seeing where your T3 levels are, I can't say for a fact if you still need it or not. But there are cases where NDT will help your thyroid function better, so it's possible. Okay, next question. I'm currently taking thyroid medications first thing in the morning between 7 and 9. My work schedule is changing and I'm getting up at 3 a.m. Is it okay to take the medication that early? Definitely. You can take the medication first thing in the morning. Just try to do it about an hour before you have any coffee or breakfast. So if you're getting up at 3 a.m., try not to have that first sip of coffee or breakfast until around 4 a.m. because you want to give it an hour to really absorb and make sure that your body is getting enough of the medication. Okay. Also, don't take other supplements around the same time you're taking that medication. So no other like multivitamins or supplements. Next question is, does thyroid problems cause snoring? It can. A lot of the time snoring can be due to having a little bit of excess weight on the body. So if the thyroid is causing a little bit more weight, that can be an issue. Having a deviated septum can cause snoring. If you have a dairy allergy, that can cause, swelling of the nose if you have allergies. So there's a whole host of reasons you could have snoring. If you've knocked out the other causes, it's possible it could be related to the thyroid, but I would work with an ENT doctor, which is the ear, nose, and throat doctor. Have them take a look, see if you have any allergies or deviated septum or anything else that might be kind of causing the snoring, or again, the excess weight can also be part of it. Okay. Is there a time and place for T3 only medication? Can T3 be taken without T4? So yes, there are definitely patients who will only take the T3 medication, patients who don't convert T4 to T3 very well. I will say it is the rarity. About the majority of patients will statistically do okay just on T4. Of, say, the maybe 20% of patients who don't do just well on the T4, normally a balance of both will be beneficial. And the reason why is the half-life of T3 is only 5 hours. So if we're just giving you the T3, we're going to have to make sure that we're giving it to you like 2 or 3 times a day. So normally it's better to get a little bit of T4 and then add in the T3, but there are cases, yes, where people just take T3. Next question. I switched from levo to NP thyroid 1.5 years ago. My symptoms have much improved. I'm finding it hard to stabilize. I've been ping-ponging between too high and too low. Is it true that NDT doses per pill can change that? Could be my absorption to NTD is more sensitive. So I think what the question is asking is, I was on synthetic medication for about 1.5 years. And before that, she had been on natural desiccated thyroid. And she's saying she's not feeling as good on the Synthroid, but when she's on the natural desiccated, her TSH levels are going up and down. And at one point, she was also taking the NDT to try to stabilize that. So a lot of the times when the levels are going up and down, the first thing we want to do is make sure that the blood work is accurate. So if you're taking biotin, for example, you want to make sure you're not taking it 7 days before you go for blood work, because that could make the results faulty. You want to make sure that you're not taking your medication first thing in the morning and then going to get your lab done and then doing the medication after. It's also possible how you're taking the medication. So first thing in the morning, an hour before any breakfast or coffee. If you're sometimes taking it closer to meals, you could not be absorbing as well. It is possible that the TSH changes are due to the way you're taking the medication. Another issue could also be if you're having any diet changes, if you're going through more phases of stress. So there's different reasons why it could change. I would really just work with your doctor and try to figure out what's causing the fluctuations between your TSH levels. And it is really common for people to feel better on the NDT as opposed to the synthetic. So if that's what's working for you, I wouldn't give up on that yet. Okay, next question is, what are your top 3 steps for Hashimoto's when first diagnosed? That's a good question. So again, I'm going to go back to gluten-free diet for at least 3 months. And then if possible, after that, trying to reduce your dairy a little bit. That's going to be really important. The next step in terms of supplements, making sure that vitamin D level is normal because that's going to bring down your TPO antibodies. And then the other thing that's really important to check is you can check for your iodine and selenium levels. Make sure a lot of people will start supplementing and their selenium or iodine will go too high or they'll be too low. And when your iodine and selenium isn't off, it can affect the conversion of T4 to T3. So making sure that all your micronutrients are balanced, trying the gluten-free diet, and then trying ways to reduce stress. There is a lot of links between autoimmune diseases and stress. So whether that's walking in nature, trying some yoga, reading a book, just something per day, at least 15 minutes to try to reduce your stress. Next question. I have hypothyroid. Can symptoms come and go? I've been very symptomatic for the past 5 weeks, but felt great for 2 months before that. My free T4 and free T3 are low. My TSH is 1.6. My iron, B, DHEA, sodium, and potassium are all normal. You might be one of the patients that isn't the best at converting T4 to T3 because you said that both your T4 and your T3 numbers are low. I would think you might be a patient that would benefit for adding on a little bit of the T3 and then also checking those micronutrients again to make sure, because I know you mentioned iron, B, D, sodium, potassium, but you didn't mention anything about iodine or selenium. So I would take a look at those two and then talk to your doctor about possibly increasing your dose a little bit or adding on some T3. Why does hypothyroid cause constipation? What are some things we can do to alleviate it? Okay, so with hypothyroid, the metabolism is slow. Sometimes the body is a little bit slower. So that in itself, people with hypothyroid often will have a slower motility rate. So that can be one reason. Another reason is eating foods that your body has an allergy to, especially if you have Hashimoto's, any kind of gluten or dairy can definitely increase that. Checking for things like leaky gut syndrome. A lot of patients with hypothyroid also have leaky gut. So if you're having any kind of inflammation in the stomach, that can also slow things down and cause some constipation. Some simple ways to help alleviate it. First thing I'm a big fan of is magnesium. So trying to take somewhere between 200 to 400 milligrams of magnesium at night. That can help bring water into the colon to help the bowel movements move more easily. Another thing really important is to stay hydrated. So make sure you're getting at least 8 glasses of water per day. Again, the more water you have, the easier it'll be to flush that stool out. If you do happen to see a gastrologist and they look at your motility and you have slower motility, there are supplements like Motil Pro by Pure Encapsulations that has ginger and the precursor for serotonin that can help your gut kind of start to move a little faster, and that can help the bowels. And then outside that, just ruling out any kind of conditions like food allergy or leaky gut. If you do find you have leaky gut, working on reducing that with either an autoimmune protocol diet, taking some glutathione supplements, working with your doctor to figure out how to kind of heal that leaky gut. Can you clarify how Hashimoto's is not a thyroid disease per se and is more an immune system issue? Yeah, definitely. So with Hashimoto's, the immune system is confused. So it thinks that your thyroid gland is tissue that isn't belonging in your body. So it doesn't recognize the thyroid as its own body. So the immune system is attacking the thyroid. And because the immune system is attacking the thyroid, over time, the thyroid isn't going to be able to produce as much T3 or T4 because it's under attack. So the more you can kind of calm down the immune system, hopefully the slower the damage will occur and the least likely you will to actually get the hypothyroid. If you kind of work with your doctor to keep those TPO levels down, try to calm down the immune system, it's possible that you won't go into hypothyroid. Is it okay to eat grapefruit? I take NP thyroid medication and recall reading that eating grapefruit is not advisable. I think what the article was probably referring to is you don't want to eat grapefruit within an hour of taking the medication. So like vitamin C, iron, a lot of different supplements, if they're taking within, honestly, even more like 2 hours of the medication, it can slow the absorption. So if you want to have grapefruit like later in the day, like after lunch, that's fine. I just wouldn't have it early in the morning when you first take your medication. How do you know if hypothyroidism is turning into Hashimoto's? Sure. So when you have hypothyroid, you're going to see that your body isn't producing enough T3 and T4 hormones. When you have Hashimoto's, you're going to see signals that your body is attacking the thyroid and your TPO levels are going to be high. So in normal hypothyroid, you're going to see probably a high TSH and a low T3 and T4, but those TPO antibodies or TG antibodies are going to be normal. So then you just have hypothyroid. But if you start to see the antibodies against the thyroid being detected, that's when you know you have Hashimoto's. So I would work with your doctor and just test for the antibodies. Can hypothyroidism or Hashimoto's be healed? It depends on the cause. So with hypothyroidism, if it was you had the radiation, probably not. If you have Hashimoto's, again, it's harder. So ideally, you want your antibodies to be under 50. If we can get your antibodies, your TPO antibodies under 50, we can say you're in a remission of a sort, meaning that your body isn't actively attacking the thyroid aggressively. A lot of people will come in with a TPO around like 700, 800, 900 higher. So that means they're very actively in the Hashimoto's. The lower we can get that TPO antibody, the more likely you're going to be in a sort of a remission. Whether it's healed or not, close to, but really just working with your doctor and your body to get the levels down will help. Does hypothyroidism make your cholesterol high? Never had an issue before diagnosed. Yeah, there's a lot of studies that link hypothyroid and cholesterol. Again, because when you have hypothyroid, you're slowing down the metabolism, so that's also going to slow down the metabolism of the cholesterol. Trying to keep your saturated fat under 13 grams per day, increasing your fiber, trying to have that good cholesterol, so like fatty fish, avocado, nuts. The more good cholesterol you have, that can also help clean out the bad cholesterol. And then just working with your primary care doctor to try to get those levels down as well. What is the difference between primary and secondary hypothyroidism? Again, it just depends on what the cause is. So if it's the pituitary not signaling to the thyroid correctly, so then the thyroid doesn't know to make enough thyroid hormone, or if the pituitary is signaling to the thyroid correctly, but the thyroid isn't producing enough of the medication, and then it's a thyroid issue. Can adrenal fatigue bring down the thyroid? What are your recommendations for getting out of adrenal fatigue? So yeah, again, with adrenal fatigue, normally you've gone through a period of stress, so your cortisol levels were high, and then they dip down because your body has been producing so much cortisol for so long, your adrenals are now tired. And with hypothyroid, we know that if you're stressed, if you've been working out a lot and the body is stressed, that's going to make your symptoms worse. So working on reducing stress levels, balancing blood sugar can help with cortisol levels as well. Making sure your micronutrients are good, having a nice clean diet, all that can help with adrenal fatigue. And then also finding if there's any like emotional components, if you've been through any trauma, like working with a therapist as well can help. Do you recommend getting off birth control to help my hypothyroidism? There's not a direct link. Some studies have shown that increased estrogen can affect the thyroid, but it's marginal, and obviously being on a form of birth control is really important. There are non-hormonal options, like the copper IUD is a good option for people who don't want to be on hormones, but there isn't a direct need to get off the birth control. I would just work with your OBGYN to make sure your estrogen levels are normal. It looks like this is the last question. After my total thyroidectomy, does Hashimoto's completely go away? So again, not completely. It should be significantly reduced, but it'll be something we'll still want to test for maybe just once a year to see where your levels are at. And I think that's all the questions for today. And I think everyone who came here, it was nice to meet you all.
Thanks, Jessica. Alrighty, guys, thank you so much for attending our October office hours. Again, my name is Alex. If you would like to book an appointment with a provider like Jessica, you can go ahead and go to our website at palomahealth.com. Just enter in all your information, and depending on your state, you will be able to book an appointment with Jessica. Again, we have a bunch of resources. Go check out our blog. We also have articles and everything on our app, recipes, workouts if you would like to do so, all on our mobile app. Go ahead and go to our website, palomahealth.com, for more resources. We have a bunch of free guides that you guys can download all on our website